Natural healing from the use of a person's own stem cells is showing remarkable results. Dr. Elliot Lander from the California Stem Cell Treatment Center in Rancho Mirage explains what stem cells are and how they're successfully used.
Stem cells are actually your repair cells, and they're different from every other cell in the body because every other cell has a very specific purpose. There's liver cells, there's kidney cells, there's eye cells, but your stem cells are the only cells in the body that do nothing other than repair you. They can fix damaged cells and degenerated cells and cells that are dying, and they can do that by either influencing them to repair or actually becoming the damaged tissue. Stem cells, as your repair cells, have a lot of different purposes and functions, but one of the most common and effective uses of stem cells is for arthritis. And arthritis can be really any area of the body, hips, back, knees, and the stem cells have the ability to heal damaged joint spaces and decrease pain and increase range of motion. There's other uses also of stem cells, which may include heart and lung diseases, chronic neurologic diseases, and autoimmune diseases where your own immune system is basically turning against your own body. And stem cells are known to mitigate autoimmune effects.
Dr. Lander gives an overview of the research.
My partner, Mark Berman, and I, in 2010, were involved in early clinical research on stem cell therapy, and we pioneered some new ideas and ways of procuring stem cells from your fat. It turns out the stem cells in your fat are much more common, 500 times more than from bone marrow, and also they're younger and stronger and better than the one in your bone marrow. So we were able to use them to synergize with your bone marrow supplied stem cells to help people heal from a number of degenerative conditions. The focus of the project we've been working on for 13 years is to use your own stem cells to heal your own body, and we call it personal cell therapy. One of the reasons it's so vital that we can get another source of stem cells than bone marrow is that procuring stem cells from bone marrow can be very unpleasant, and also the numbers are very low. But using the fat, we were able to achieve very, very high numbers. It can be done in the operating room as a simple minor outpatient procedure. And then we can create large numbers of your own healing cells and then introduce them to the area they're needed. And when you take a large number of healing cells and focus them on a damaged area of the body, in a small period of time, in a small area, then you create what maybe the military might call a surge. But in this case, it's a healing surge. We only focus on using your own DNA, so it's a form of precision medicine. If we can use your own DNA to heal you, it's a perfect match.
Dr. Lander introduces us to his patient, Connie.
This is Connie. She's had some orthopedic problems, including hip and knees, and we worked on her to help her with mobility.
The problem was my hip and my leg, my left hip and leg, and he gave me stem cells, which were my own. We harvested, and there was no pain involved, and I had what I felt was instant relief. I was completely better within a couple of months.
Dr. Lander explains the stem cell treatments.
Connie's received a knee injection of her own stem cells. Right now what we're doing is infusing intravenously additional stem cells from her own body that were stored cryogenically and can be used over and over again for helping her heal. We found very early on that using systemic therapy in addition to regional injections, we actually got much better outcomes when we added the intravenous infusion. And the reason for that is that stem cells have the capability of something called homing, which means going around the body naturally and looking for damage and finding it themselves. They seek out damage beacons and respond to them. So the cells are smart, and we rely on that. It's important to remember that a lot of patients are going to stem cell treatment centers, and most of them are receiving other patients' cells. We, on the other hand, are giving you your own cells back. It's precision medicine. It's your own DNA, your own body's healing system. The procedure itself takes a couple hours, but stem cell healing takes weeks to months. It's not uncommon to wait 4 to 12 weeks to start to see results. And that's because it's not a medication. It takes time to regenerate and heal your tissues fundamentally.
The success rates of these procedures are impressive.
California Stem Cell Treatment Center is a data-driven organization. We started collecting data in 2010, and we now have data using our procedures on over 15,000 people. So if a patient comes to me and asks what's their chance of success for their knee procedure, and we look at knee osteoarthritis in our database and 6,300 patients come up, it shows 83% success rate. We're really helping people heal themselves using their own body parts in a natural way. This is the way healing has occurred since the beginning of time. We're just trying to harness it, improve it, and make it more efficient. We perform the stem cell treatments in our office in Rancho Mirage, and we have another location also in Beverly Hills.
For an appointment with Dr. Lander, please call 760-346-0145